This episode of Doc Talk is brought to you by First Bank. We're not just your neighborhood bank, we're your neighbors. Our local team lives up to the name, putting our customers and community first. To experience First Bank difference, stop by any of our 13 Knoxville area locations or visit firstbankonline.com. First Bank, member FDIC.
Hello, my name is Dr. Robert Page, and welcome to Doc Talk. Doc Talk is a podcast which is sponsored and run by the Knoxville Academy of Medicine, which features its member physicians in an interview format, providing patients with information to help them further along their medical care and to give them information on things that are important to them, which may or may not be topical. And with that in mind, today I have with me Dr. Eric Pennaman. Dr. Pennaman is the medical director for Summit Medical Group,
right,
and is a family practitioner. Has been here for the last 4.5 years in that capacity. And he is here with us today to talk about hepatitis. Now, in this day and age when everybody's talking COVID,
right,
the most, apparently the most important virus to ever hit mankind.
Yeah, it must be. Yeah.
Apparently that's not so.
Yeah.
Apparently there are other things which are more important. So talk to us about hepatitis.
Yeah, and particularly hepatitis C.
Okay.
And one of the reasons why I wanted to talk about it is in March, the United States Preventative Services Task Force recommended that everyone age 18 and older be screened for hepatitis C. And when I dug into that to try to see, well, what's the rationale behind it? It makes a lot of sense in that of the top 60 reportable diseases, and you know, of course, as a doc, but we have to report infectious diseases that could spread throughout a community to the health department. And so of the reportable diseases of the top 60, which includes HIV, tuberculosis, and some granddaddy ones, of the top 60, hepatitis C kills more people than the other 59 combined.
Wow.
Now, March, of course, hit just as the pandemic was hitting, so hardly anybody talks about hepatitis C. And honestly, very few people age 18 and older are being screened for hepatitis C. And given that it's, it can be a very deadly virus that now has such great treatment that we can cure 99% of patients who are infected with hepatitis C.
Wow.
Yeah.
So I remember from my residency, and you and I talked about this briefly, is that hepatitis C was rampant, and the only real therapy that we had to treat these patients was liver transplant.
Yeah.
And that's not true anymore. Now there's
Right.
a new medication out on the market which can treat that.
Sure. Yeah. There's several of them, and even some of the most effective ones now are generic. So the cost to treat, which initially was about $80,000 to treat one case,
Wow.
now it's closer to $10,000, which you might say, wow, that's expensive. But compare that to the cost of a liver transplant, which is
exactly.
over $250,000 to do a liver transplant, and you save a life, and you avoid liver cancer and all of those things. Boy, we need to detect this stuff because we can treat it and save a lot of lives.
Absolutely. So now, are there any particular patient groups that are more at risk? Now, I know you're saying now that the recommendations are everybody 18 and over.
Yes.
But let's say I'm in my 50s, in my 60s, I'm otherwise healthy.
Yep.
I'm monogamous. I'm not a drug abuser. Any sort of risk factors. What are the risk factors, first of all, for mentioned a couple of them, but what are the risk factors for getting it? And should I be screened if I'm in my 50s or 60s and otherwise I'm healthy?
Right. So the good question to ask is, when were you born? Because the original screening guideline came out essentially saying baby boomers, people born between 1945 and 1965, should be screened at least once. And the reason is back then the blood supply wasn't screened for hepatitis C. So if you received a blood transfusion or got exposed to a blood product when you were young, even at the time of birth, you could have gotten hepatitis C. And so we have recommended for a little while now to screen that population, but you hit on a lot of the risk factors. Certainly, one of the reasons why hepatitis C is endemic in East Tennessee is because of the opioid drug problem that we have, and a lot of people choose to inject their opioids. And so IV drug abuse is by far and away the biggest risk factor. Sexual promiscuity. Hepatitis C is spread typically through sexual contact or IV blood product type of interactions. So those are your high risk categories. But it's a silent disease that you may not know you have it, and that's why it's important to screen for it.
Right. So everybody. So essentially, when you say everybody over the age of 18, you don't mean at age 18. You mean everybody from 1945. I can't do the but anybody mid 70s and younger should be screened.
Yeah,
for that.
exactly. Because based on the definition, I'm also in a low risk group, but I went and got screened just because it's the recommendation, and you just don't know what you could have gotten exposed to. And if you are in a low risk group, you get screened and you're negative, you're good to go the rest of your life.
Gotcha.
So
now, should I, if I've been to see my doctor in the last year or the last couple of years, or if I routinely see my doctor, is this something that I should automatically assume that they've already screened for, maybe? Or would this be something, you mentioned it's a new recommendation,
right? But
is it possible that I could have been screened for it before, or is it not very likely?
I would say it's not likely, just because when the new guideline came out, all we've been thinking about in medicine has been COVID, and everything is COVID. Now everything is about how can we vaccinate as many people for COVID. And so some things just get missed, and that worries us simply because we know that there are a lot of other causes of death out there, and we need to make sure that we're attending to those while taking care of the pandemic.
Yeah, because you mentioned that as significant as this virus is, it's it kills more people than the other 59 combined, or the other reportable diseases combined.
Right. Yeah.
So which is unbelievable. Of course, we know a lot about the deaths from COVID, but
yeah,
people die from other things during epidemics as well, and it's important to as you mentioned, to be screened for these other ones.
Yep.
So you talked about the treatment. Now we know about we currently are getting the vaccinations for COVID. There is no vaccination for hepatitis C.
Correct.
So what does the treatment for hepatitis C involve?
So typically you go through an initial workup to define what stage you're at, whether or not you have any fibrosis, which is the kind of an early cirrhosis. A lot of public understands cirrhosis, but fibrosis is beginning to have scarring in the liver.
Okay.
And so we best treat hepatitis C before the liver has significant evidence of damage. And so in that situation, like I said, it has a 99% cure rate. So if we detect hepatitis C years down the road, it could be too late to have cured them. And then they still are on a trajectory where they may need a liver transplant. So sooner is definitely better, which is true for about any disease in medicine.
So, and then the therapy, is this an injectable drug? Is it a pill? Is it how does that treatment work?
Yep. Typically a once daily oral pill that you take, depending on the regimen, 8 to 12 weeks, and you're cured.
Wow.
I know. It's pretty phenomenal.
I was going to say to be able to come up with these things during our lifetime. I mean, I was impressed enough when we figured out, we were able to figure out, the COVID vaccine as fast as we did.
Yeah.
Especially the way it was done. But that's unbelievable, considering that was a disease that, it was like similar to HIV. I mean, when I was a resident, which was 20 years ago.
Exactly.
So these patients were just, you get a liver transplant, or you would just die. Which is really bad. So we have good therapies for it when we have these drugs. You mentioned about the cost. Now, just to ask a little bit about logistics in terms of patients and having insurance and paying for these things.
Sure.
Now, the screening test, is that something that insurance would pay for if I were to go see my doctor and say, hey, check out the new recommendations. You're supposed to be screening me with this, not screaming at me. You screaming at me too to make sure.
Scream at our patients, but yeah.
So, but is this something that insurance would pay for?
Yeah, absolutely. And that's when we say something's recommended by the United States Preventative Services Task Force. They work with Medicare, who sets all of the coding rules. So when they say it's recommended as a preventive screening, that means it's automatically covered, no patient out of pocket, so 100% coverage. And so regardless of what insurance you have. So if you have insurance out there, now if you have no insurance, not even 10 care, and you're out of self-pay, then there could be an out-of-pocket cost in that situation, but there aren't that many.
So, but typically this is a routine test for which my insurance would pay if I have that. Yeah. So now, what about, you mentioned about the cost of the therapy? What about that?
Yeah. So I mean, certainly if somebody
ends up being positive,
they're positive and they have no insurance, there are programs out there for self-pay, and if somebody can prove that they're at a federal poverty level, they can oftentimes get the medicine for free. So
Gotcha.
There are definitely programs out there. The bottom line is that there's a public health concern with hepatitis C. We want that person to get treated so that they don't spread it to others. So there are systems in place to make sure that they get treated.
Gotcha. So you're talking about hepatitis C. This is something mainly for to help the patients understand. So hepatitis C is not like hepatitis you would get after eating shellfish or hepatitis.
Right,
And there's another form of, so there's hepatitis, there's several different types of hepatitis,
sure.
aren't there?
Yep.
Which are viral, and those are, and what are those generally?
Well, so get the hepatitis you might get from shellfish, or you remember the Chipotle and the big thing.
Oh, yes.
Sorry, Chipotle, for even bringing that up again. But anyway, but that's hepatitis A.
Okay.
And so that is spread typically from the feces. So to be blunt, someone didn't wash their hands real well after using the restroom.
Gotcha.
And then they prepared the food, particularly preparing lettuce and vegetables, and then you eat that fresh, and the next thing you know, you have hepatitis A.
Gotcha.
And so very few people die of hepatitis A, and you typically do recover, although they feel like they might die. Oftentimes it's not necessarily an easy thing to get. Hepatitis B is very much like hepatitis C in that you can get a chronic form of it that can lead to liver failure. The treatment for hepatitis B has also improved quite a bit. It's not as much of a slam dunk as hepatitis C. The risk factors for hepatitis B are the same. Sexual promiscuity, IV drug abuse, those types of things.
So, but now we have immunizations for hepatitis B as well.
Exactly.
So,
yep.
and I think there are actually immunizations for hepatitis A as well now, aren't there? Aren't there some available? But the bottom line is that if I'm a patient and I've been told that I have hepatitis A or hepatitis B, I should not automatically assume that I've been screened for, or that I've had hepatitis before. I've had any form of hepatitis, that I've automatically been screened for this particular type.
Correct.
Okay, so I mean, and I wouldn't be immune if I'd had hepatitis A before or anything else like that.
Correct.
Okay,
Yep.
so
Yep.
which is important to know. So let's. I want to talk a little bit about your medical group. Now you're with Summit Medical Group.
Yep.
And tell us about how many physicians are with Summit Medical Group.
We've got about 190 physicians and another 160 or so physician assistants and nurse practitioners. So we've got 70 sites in 15 counties all over East Tennessee.
Wow. So, and going from where to where? I mean, if I'm a patient, I'm watching this, on the internet. Can I look for a Summit doctor in my area typically, or they?
Typically, if you're in East Tennessee, other than once you get north of Greenville, we have many docs in Greenville. You go north of Greenville, that's the Tri-Cities area, and Ballard and in Holston Medical Group and the state of Franklin. They're the groups up there. And then Greenville all the way down to Athens and Madisonville is Summit Medical Group territory. And we have clinics as far north as Campbell County up in Jacksboro area.
So I would not have to travel very far if I wanted to see a Summit Medical doctor.
Yeah.
And let's say that I was interested in finding a Summit Medical doctor in my area. Where would I go? Is there a website? Is there a phone number I can call?
Yep. Summitmedical.com. And right on the banner, you'll see locations. And there are many locations, and you can search for a particular doctor. If you have certain characteristics in a doctor that you might like, you can do all those kind of searches and find a great match.
Most excellent. So not necessarily just for hepatitis, for anything else I might need. You have doctors that specialize in many different areas.
Yeah, we are almost strictly primary care. We have a rheumatology group, but otherwise we're almost strictly primary care. So we're pediatrics, family medicine, internal medicine, pediatric specialists, combined. So,
gotcha.
Yep.
So mainly just sort of general practice type. Okay, understood. And this is the point where I usually say David's going to use some screen magic to kind of put if there's a contact number that we can call up. If there's a general number for Summit Medical Group, we can call that number and make sure. So I usually at this point I say we'll put your location underneath there, but I think we'd have to scroll the entire time if we wanted to put all of your locations.
It'd be like the snow day.
I was going to say that's right. I'm waiting for Knox County. Well, Dr. Pennaman, thank you so very much for joining me here today.
Yeah, sure.
And thank you so much for giving us this information about hepatitis C, an important thing that we should know about because it is now recommended that we get screened for it.
Yep.
Insurance will pay for it, and it is treatable.
Very treatable.
So this is incredible. So,
yeah.
And with that brings this episode of Doc Talks to a close. Doc Talk, David. I'm sorry. I know it's a singular Doc Talk. Doc Talk to a close. Doc Talk is a podcast which is brought to you by the Knoxville Academy of Medicine, which features its member physicians giving information to patients for their continued well-being and healthcare needs. Thank you so much for joining me today. I'm Dr. Robert Page.
This episode of Doc Talk is brought to you by First Bank. We're not just your neighborhood bank, we're your neighbors. Our local team lives up to the name, putting our customers and community first. To experience First Bank difference, stop by any of our 13 Knoxville area locations or visit firstbankonline.com. First Bank, member FDIC.